A randomized clinical trial on the experimental assessment of carbon dioxide content in inhaled air with or without face masks in healthy children was just published on June 30th, 2021 in the Journal of the American Medical Association. And this is a peer-reviewed medical journal. And it's shown that 68% of the participating children had problems when wearing nose and mouth coverings. The normal content of carbon dioxide in the open is around 400 parts per million. A level of 2000 parts per million is the limit for closed rooms, according to the German Federal Environmental Office, and everything above this level is considered unacceptable. Dead space volumes in masks collect exhaled carbon dioxide quickly. This carbon dioxide mixes with fresh air and elevates the carbon dioxide content of the inhaled air under the mask. They measured between 13,120 and 13,910 parts per million of carbon dioxide in the inhaled air under surgical and FFP2 masks, which is higher than what is already deemed unacceptable by the German Federal Environmental Office by a factor of 6. This was a value that was reached after only 3 minutes of measurement. Children under normal conditions in schools can wear masks for up to 270 minutes. The youngest children had the highest values, with one 7-year-old child having a carbon dioxide level measured at 25,000 parts per million. This is 12.5 times higher than the accepted level of carbon dioxide. Hypercapnia is the buildup of carbon dioxide in your bloodstream. It can affect people with diseases like chronic obstructive pulmonary disease. If you have COPD, you can't breathe as easily as other people do. You can see my other video on COPD for some natural ways to help you breathe and deal with oxygen deprivation. Carbon dioxide retention can cause effects such as headaches, dizziness, and fatigue, as well as serious complications such as seizures and even loss of consciousness. The effects of hypercapnia and acute cerebral injury have been described in several studies. Most suggest that normocapnia after a cerebral injury is associated with a better clinical outcome, and that hypocapnia and hypercapnia are associated with poor clinical outcomes. Extreme hypercapnia produces more severe cardiovascular depression than is seen in animals subjected to lesser degrees of hypercapnia. The cardiovascular depression, in turn, leads to greater cerebral ischemia and ultimately results in brain damage. As well as too much carbon dioxide, you have hypoxia, which is a condition where not enough oxygen makes it to the cells and tissues in the body. This can happen even though blood flow is normal. Hypoxia can lead to many serious and sometimes life-threatening complications. When the brain becomes oxygen deprived, it has an impact on your thinking abilities. Cerebral hypoxia occurs when your brain doesn't get enough oxygen, and without oxygen, brain cells die, and a brain injury will occur. Some possible solutions that can help you deal with being deprived of oxygen for long periods of time. Nootropics are drugs, supplements, and other substances that are claimed to improve cognitive function, particularly executive functions, memory, creativity, or motivation in even healthy individuals. The term nootropic was coined in 1972 to describe a new classification of molecules that acted selectively towards the brain's higher level integrative activity. In order for a product to qualify as a true nootropic, it must fulfill 5 criteria. It should aid with improvement in working memory and learning. It should support brain function under hypoxic conditions or after electroconvulsive therapy. It should show protection of the brain from physical or chemical toxicity. Your natural cognitive functions are enhanced, and it's required to be non-toxic to humans without depression or stimulation of the brain. Some of the most popular and best nootropics are the racetams. You can see my other video on piracetam and Noopept as 2 possible ways to help to protect your brain if you're forced to wear a mask and be in a hypoxic state for an extended period of time. Methylene blue is the treatment of choice for symptomatic drug-induced methemoglobinemia and in asymptomatic patients with methemoglobin levels of greater than 20%. This chemical, which is used as a blue dye in denim jeans, is also used in the nootropic community for its brain-boosting capabilities. It works as a powerful electron donor in the brain in times of severe hypoxia. It's so powerful at protecting the brain that it's used in hospitals to save your life if you try to commit suicide from carbon monoxide poisoning. Vinpocetine is extracted from the periwinkle plant and is used to increase circulation to the brain, and this can help improve cognitive function. It's also been shown to reverse hypoxia-induced memory impairments in rats, so the increased cerebral blood flow and the oxygenation may be beneficial here also. Cordyceps sinensis is an edible mushroom that grows in Himalayan regions and is widely recognized in traditional systems of medicine. It's used by athletes for its ability to increase blood oxygen levels. Overall, Cordyceps sinensis treatment inhibited hypoxia-induced oxidative stress by maintaining higher cellular levels of NRF2 and lowering NF-kappa B levels. The highest altitude growing root vegetable, maca, has been used traditionally as a way to help people acclimatize to low oxygen, high altitude environments. Results showed in a mouse model that maca powder could significantly prolong the time until hypoxia occurred, and it also increased endurance in the forced swim time test. Haritaki fruit has been used for thousands of years with great success in India. This wonderful fruit grows in Asia and it's common in Ayurvedic medicine. It's great for cleansing the GI tract and building up good probiotics and thus improving our immune system. It's one of the few foods that's said to balance the 3 doshas or energies of the body, vata, pitta and kapha. It has the potential to increase blood oxygen levels by up to 300%, meaning that it may also have a protective effect from the oxygen deprivation that can occur when you're wearing a mask for a long period of time. Many people are unaware that they're deficient in vitamin B12. A vitamin B12 blood test can fail to detect a deficiency due to food now being fortified with folate and this throwing off the reading of the test. Being deficient in B12 causes physical and psychological symptoms, including nerve problems, fatigue, and difficulty thinking. Most vitamin B12 deficiency symptoms occur due to a lack of red blood cells, which means that your body does not get enough oxygen. If you can't get B12 injections, be sure to use the sublingual form of methylcobalamin. Clinical iron deficiency disturbs normal responses to hypoxia, as evidenced by exaggerated hypoxic pulmonary hypertension that's reversed by subsequent iron administration. Disturbed hypoxia, sensing and signaling, provides a mechanism through which iron deficiency may be detrimental to human health. New research is showing that synthetic forms of iron are bad for your health, therefore ensure that you only consume food sources of iron. It's obvious that there can be oxygen deprivation and excess carbon dioxide accumulation when you have to wear a mask for an extended period of time. It's also shown how oxygen deprivation and excess carbon dioxide can lead to impairment of mental function and, in extreme cases, even permanent damage to certain areas of the brain. One's resistance to oxygen deprivation and carbon dioxide accumulation can depend on many factors, such as an illness like COPD, an iron or B12 deficiency, or the athletic ability, which can be quantified as the VO2 max of the patient, etc. If you're forced to wear a mask for an extended period of time, it only makes sense to try to mitigate the potential for any brain damage by using various nootropics, research chemicals, and nutrients. Remember, this is not medical advice. Always discuss any supplementation with your doctor.